That shop has been there for 39 years. It entailed doing the hospital round, delivering papers to the patients, and if there was something I hadn't got, I would go down the town and get it for them, and general things. And I did that 7 days a week. So it was great at one stage, but then when the services were taken from us, like maternity, gynae, surgical, the business went down, and I had no other option only to close, which was very sad for me because, as I said, I loved it. I looked forward to getting up every morning, going to my work, and I was just devastated,
This is such an abominable failure. I'd be in dereliction of my duty as a public representative if I didn't go on the record to state the obvious and to condemn outrightly this government's treatment of the people of Monaghan, particularly in relation to healthcare.
The whole direction of health policy today, it almost mirrors the decisions years ago in relation to the closure of the railways. It's on a grander scale, the notion of closing down rural post offices and other services in the lesser populated areas of the countryside.
The government dropped the policy, they developed Hanley, the Hanley report, and the HSE is there purely to manage how to provide the policy, how to develop the policy.
If I put in a question in Dáil Éireann, direct it to the Minister, she will simply pass it back to me and advise that the HSE will answer. Remember, she is the Minister responsible for taxpayers' money of 14 billion, and yet she is ignoring any role in that.
Onto the HSE came in, it was the Minister, and it's still the Minister. The Minister uses the Health Board and the HSE to protect himself, but he is the Minister of Health, or she is the Minister of Health, whatever it is, the buck stops with them in the last day.
It's been suggested, Quaveen, that Monaghan has been punished for voting opposition TDs in the past. It's sometimes been said that if we only return the Fianna Fáil TD, that then we would get the goodies, and not until then.
The reality of it is that the people of County Monaghan have returned 2 government deputies in the last general election, in Rory O'Hanlon and Brendan Smith. We also have 2 senators from these counties, in Francie O'Brien and Diarmaid Wilson.
Because of his role as Can Corla, he is, and I'm not saying that he's not chipping away, but he's limited. He can't attend political meetings.
It would seem to suggest, though, that voting for Dr. Rory O'Hanlon was maybe not such a good idea then, wasn't it not, if he can't actually make representation?
Well, you see, when people voted in the last election, nobody knew that he was going to become Can Corla. I mean, the Can Corla is a high office, and it's a very prestigious and an honourable office. And I mean, such is the honour that the person goes back, they're re-elected. Without having to face the people. It's just a pity for the people who voted for him, maybe hoping he would represent them, that he can't. Well, no, he can, but he cannot attend anything that's of a political nature.
Some people argue that Monaghan is being punished for not voting for government parties.
Well, personally I think that's crazy. No, it is just, Monaghan is the guinea pig in this whole issue. And I think the sooner the people of Ireland realise that this government has the same idea for at least 20 other hospitals around the country, the quicker, because that is going to happen to hospitals like Roscommon, Nina, all over the place, if they get carrying out what they intend to do at Monaghan.
Well, there's a lot of anecdotal stuff being tossed about, and it's political stuff. I'm picking it up, politically. Right from the week I was elected,
Locally, has Fianna Fáil failed the people of Monaghan in the way that the hospital has suffered over the last few years?
Well, I think, Fianna Fáil hasn't had a representative in Monaghan town.
People are saying, you've elected Podge Connolly, he's done nothing. Why do you vote for my party rather than Podge? Why didn't you vote for my party rather than Podge? And that's what it's about. They absolutely they dread the fact that I'm in the field.
A wrote the song Hospital Shame just out of sheer frustration and anger at the arrogance of the government and the HSE and the dismissive nature in which they treat the people of County Monaghan. And that Paddy's gone, but Tom's still here, 'cause the General saved his life last year. But many more with their lives that have to pay if we take our hospital away. The people of Monaghan are just been dismissed. You know, you could get angry even talking about it and thinking about it, and that's where the song came around from. So cabinet men, listen to our voice. Remember, you're there by our choice. Shame on you all for what you've planned for the little hills of Monaghan.
It strikes me that, you know, since 2002 that it has downgraded further.
No, look, tell me, Ronan, just, are you a member of a political party?
No.
There's a lot of political nonsense being talked out there. Like, I mean, you know, people will tell you that Monaghan General Hospital never looked better than it looks now. And that is the fact of the matter. Never was there more money spent in Monaghan General Hospital than there has been spent this last 5 years. And I'm not foolish enough to try and equate that and say there's no threat. I'm fully aware of the threat that exists. But the coming back on call, like, where did that emanate from? You know, are people saying that it's worse now than it was 5 years ago? I'm saying that at 1.5 years ago, there were 5 inpatients. It was off call. And there were 2 boilers, one of them defunct. Now, one of the first jobs I had to do when I got elected was highlight the issue of the boiler. Now, there was a new boiler put in there at a replacement cost of $750,000. So the things started to slowly redevelop, if you like.
I mean, in the last 5 years, there has been investment in the hospital. I mean, the boilers were, you know,
but
upgraded.
It's money invested in areas that aren't so important to the local people. I mean, they want to see emergency medicine.
Well, for example, 2 of the main things that I have been looking for over the last number of weeks since I've been selected as the candidate. One is the immediate delivery of the CT scanner, which was promised. Now, that would be very, very important to the hospital.
Sometimes these developments and investments can be kind of superficial, can't they? You know, like the way it appears, but the services haven't really improved.
Well, okay, services, like, I mean, yeah, they're superficial. Yeah, well, on-call service, medical on-call has returned. That is a service.
When was the CT scanner promised?
Well, Micheál Martin promised it when he was Minister,
right.
And Mary Harney gave a commitment last year, and the CT scanner has still... the CT scanner has been hanging around in the air for a long period of time, but I'm looking for the immediate delivery of a CT scanner to the hospital.
We mustered here in 24/7. We mustered here in the high care ward, or the intensive care ward, whichever we like to call it. The treatment room that was opened some months ago is absolutely invaluable and must be kept open on a 24/7. And the only way that can be done is if we have 5-day surgery rather than day surgery 5 days a week.
I'm not tied to any party. I voted Fianna Fáil all my life, because they're a party, there was a social element in Fianna Fáil, and it seems to be now gone. But they always said that social element where they looked after the workers, they looked after the poor and everything else. But the like of this crowd there now don't seem to have that in mind at all.
People in Monaghan, as elsewhere, have always accepted the requirement to travel for specialist care. But for the fundamental run-of-the-mill, and particularly in the situation where an emergency presents, we must have that facility.
HSE and recently even told us we can't talk about individual cases. You don't make policy based on individual cases. That's rubbish. Individual cases are what make the numbers. So it's people dying who add up to death rates.
It will take a major fight to stop our politicians selling off our health services to the highest bidder. It'll take people like the people of Monaghan to win that fight, and that's why everybody should support the Monaghan Community Hospital campaign. Everybody. It's in all our interests. It couldn't be more important.
Professor Drum keeps saying there'll be a safer service in place before any services are removed from Monaghan. Gobbledygook is what I'd say to that. He hasn't shown anything of the sort in what he's doing already in Monaghan and what he's doing in other hospitals in the region. So it's hard to believe a word he has to say.
I don't detect people are totally disillusioned with the government and there's a lot of negativity out there. I don't detect that.
Mm-hmm. The people of Monaghan are resolute people, and we're going to fight, and when we're finished fighting, we'll fight more.
I believe that the only way you will save Monaghan Hospital is to have a change of policy, and the only way you can have a change of policy in the present situation is a change of government.
And I'm convinced there is a chance here, an opportunity exists for real change.
That dark cloud above all our lives has got to be removed.
The threat never left, I will admit, but I would contend that the thing is better now than it was 5 years ago.
I spoke to Fianna Fáil party here in Monaghan. One fella came out here looking for a vote, and I said to him, "You're getting nowhere." And he says, "Well, Smith's going to do this." I said, "He'll get the crumbs falling on the table." And Willie said to me, "We'd be glad of the crumbs." I said, "Feck off, glad of the crumbs. You want something major in Monaghan, not crumbs."
Now Paddy's gone, but Tom's still here, 'cause the General saved his life last year. But many more with their lives they'll have to pay if they take our hospital away. So Cabinet man, listen to our voice. Remember, you're there by our choice. Shame on you all for what you planned for the little hills of Monaghan. Calvin, Monaghan and Donegal, you would have gladly sold us all. Again we are betrayed, and it is sore. We can't take it anymore. So Cabinet man, listen to our voice. Remember, you're there by our choice. Shame on you all for what you planned for the little hills of Monaghan. 30 pieces of silver, oak you now demand.